person-centered care is an approach ensuring every patient is treated with dignity, compassion, and respect within the healthcare system, achieved through the equal partnership of health and social services. Patients should have the autonomy of planning, developing, coordinating, and actively participating in the management of their own health and well-being. The purpose of person-centered care is not only to provide healthcare and support, but to analyse various situations and conditions that differ between patients, such as individuals' values and beliefs. This can be achieved through respecting cultures and values, to be empathetic regardless of differing circumstances and opinions. There are 5 key components that contribute to an all-round person-centered care adapting to each individual's needs. Cooperating with individuals' differing beliefs and values is the first key component of person-centered care. While delivering care to patients, nurses need to treat them with dignity and respect. Supporting personal perspectives and preferences involves patients in their care and provides a treatment that both the nurse and patient think is appropriate. Secondly, it is important that healthcare professionals authentically engage with their patients. Full engagement is the level of optimally connecting both nurse and patient in providing a direct pathway to achieve a shared vision of care. Subsequent to this, if a nurse puts their opinion to the patient's situation and arrives to a personal conclusion, a partial disengagement between nurse and patient can occur. This can be detrimental to the patient's outcome. Similarly, if a nurse completely disengages with a patient and turns to a completely biased point of view against the patient, this then calls for a reconnection of the relationship between nurse and patient. Thirdly, decision-making is a crucial and necessary factor in person-centered care. The nurse uses their knowledge and experience in combination with the input and opinion of the patient to arrive at a decision that optimises a mutually agreeable care pathway. Fourthly, a nurse should adapt a sympathetic presence that builds a therapeutic partnership between nurse and patient. This fosters greater communication and consequently better understanding. Focusing on patients' needs and perspectives allows a nurse to build an understanding of the patient's losses and existing limitations. Finally, a nurse needs to provide holistic care for the patient. This requires a nurse to be aware of not just the individual patient's physical or mental health, but to be aware of the many factors contributing to a patient's individuality. These could include the socio-cultural, developmental and spiritual dimensions of the patient. In any part of life, leadership is important and holds an integral part in the process of everyday living. Nursing is no exception to this. Within nursing, good leadership is attained through sufficient and verifiable knowledge, as there are multiple challenges to good leadership. The 5 components of person-centered care provide clear direction towards a shared vision between nurse and patient. These components can be challenged by differing factors including ineffective communication, lack of decision-making, and poor rapport between patient and client. Positive changes are enabled when the nurse presents the patient with an opportunity to participate as an individual, such as a person-centered innovation that has been implemented within dementia facilities. It is important to achieve a person-centered vision through both nurse and patient, achieving clear and precise directions, goals that are measurable and accessible and relate to each individual and can be achieved in a timely manner. Each individual and their families must be given the required education, various options to choose from, and the opportunity to make autonomic decisions based on what they believe is best for themselves, allowing a shared vision to be achieved. A successful person-centered innovation that has been implemented within dementia facilities is the modification and individualization of physical environment. Individuals with dementia commonly present with behavioral problems that are triggered by environmental factors that differ for each person. These problems can cause stress, a reaction or an unmet need for the resident, and thus ultimately decreases their quality of life. Modifying a facility to become barrier-free, more home-like, private, personalised and safe can help manage disruptive behaviours. The implementation of these aspects of a less traditional design is associated with residents becoming more aware of their environment, less agitated and aggressive in behaviour, and causes an increase in their activities of daily living. However, the effectiveness of this practice should be routinely assessed and adapted according to other evidence-based practices and research. Ultimately, the change of the resident's care environment allows for person-centered processes and thus allows for person-centered outcomes to be achieved. In conclusion, we would like you to participate in an activity of person-centered care. Get into a group of 3. You will need one observer, one questionnaire, and then a patient or someone who is being asked the questions. The observer's task is to observe the body language of the person who is being asked the question and the way they respond. The questionnaire places themselves in a position where they are not too close and not too far away from the person that they want to ask questions to. Then they proceed to ask person-centered care questions, such as, how are you feeling today? Did you enjoy the breakfast? Did you sleep well, feel rested, or want to sleep more? Make sure you pause and listen for a few seconds before you ask the next question, depending on the manner the patient answers. Ensure you make eye contact. Depending on the person's age and gender, youth and children prefer more eye contact. Elderly people prefer eye contact, but to a minimum. The person being asked the question, answer the way you prefer or want to answer. If you prefer to be silent, be silent. If you prefer to answer, please do. The reason for this 1-minute activity is to get a first-hand feel of what it means to ask questions that offer care and for experiencing the emotion of being cared for. Finally, the observer is to share his observations on how the questions were asked and if they could have been a better way to ask them, including the person's approach as well as his observations of the person who is answering. Person-centered care values are simple and basic common sense, which can often be missed. Simple, concise, precise, and being observant are the core of person-centered care principles.